Could you please introduce yourself and the course you teach?
Sure. I'm Dr. Galves, and I teach PSYC 414, which is cross-listed as Neuro 414.
Can you please give a brief overview of what is covered in your course?
So the PSYC 414 it's looking at the neurobiology of learning memory, and we really approach it from kind of more of a holistic approach, in the sense that the beginning of the course focuses more on kind of a historical point of view and looking at learning theories and learning theorists. And so that's kind of probably is the area that most MCB majors hate in this course. And it's in the sense that we talk a lot about Donald Hebb, we talk about Skinner, different learning, basic psychology learning theorists. But then as the course progresses, we then transition into more of a structural analysis of learning mechanisms, and then into the biochemical reactions and molecular processes that occur with those learning processes, and trying the entire time to keep kind of a holistic approach in terms of understanding how all of these systems work together. And we're not just obviously studying a biochemical reaction, but you're studying how that biochemical reaction then manifests into changes in behavior and changes in learning and learning processes.
What kind of background knowledge does a student need to take this course?
So to take this course, I think probably one of the best courses to have kind of under your belt in terms of approaching this class would be probably PSYC 210. And just simply because that class would give you at least an introduction to the brain and kind of introduction to some of the biological side of psychology, and looking at not the brain in terms of cognitive processes, but looking at the brain in terms of hormones, molecular processes, molecular cascades, and more, I think, questions that obviously MCB majors would be more interested in.
How do topics covered in your course apply to current research / medico/scientific advancements?
Well, I mean, one of the things I do, not in the beginning of the class, because in the beginning of the class there's a lot that we have to kind of get in terms of the foundation of the research, of the field, basically. But one of the things that I definitely do throughout the course is bring in very modern publications, I bring in modern research that's being conducted, and so kind of the modern understanding, or the current understanding, I should say, in terms of how our brains actually consolidate information, and the molecular and the biochemical processes and the brain regions where those molecular processes are occurring, is something that we spend a lot of time on in the course. In terms of how this translates to kind of more current, or not current, but direct relevance, I guess, to a clinical side or to real world situations, we are constantly dealing with memory impairments. If you talk about just simply getting older, you're having memory issues. You can look at even a lot of drugs that people are on cause different types of memory deficits, and of course there's neurological disorders, and all of these different conditions have at least a common thread to them, in that these patients suffer from deficits in terms of being able to store and remember information.
What other classes in MCB go well with the content you are teaching?
You know, I mean, I thought about that for some time, and it's a little difficult, because the content that we go through, I don't think is really covered in very many classes in MCB. You might get a little bit of hint of glimpse into it in terms of looking at some of the biochemical reactions that occur in a cell, but in this particular class, we focus exclusively on neurons, and even more so, we spend about half the semester on the synapse, and where a lot of learning processes are believed to occur, and learning mechanisms. And so we spend a lot of time looking at kind of the molecular cascades that are happening both on the presynaptic as well as the postsynaptic terminal. And so I don't really know, to be honest with you. I mean, like I said, I guess in terms of the MCB, there are some MCB courses on campus that look at kind of NMDA receptors and AMPA receptors. These are basic glutamate receptors in the brain. And so, again, there's a few courses on campus that do that, but for the most part, the way that we kind of look at that, but also tie that all in with general behavior of the animal or the patient or the subject, and even what area of the brain are we looking at, because not everything is happening in the brain's not just one big blob. It's divided up into different sections, and different sections have different roles, and so you would expect different types of plasticity to be happening in different areas. I don't think something like that's covered in any other class on campus.
What should a student do if he or she is having trouble with your course?
So my class, like any other lecture course on campus, of course we have a TA. The TA is obviously a wonderful resource for getting in touch with the TA. Obviously there's reading the book. With the way that I treat the book in this course is I treat it as kind of a platform for us to jump off from. And so there's a lot of kind of background information in the book that we can then build upon in terms of the lecture. But one of the things that I do highly stress for anybody in my class is that set up an appointment, set up a time, email me, and my door is always opened. I don't have an official, for this class, if you do take it, you'll notice I don't have an official office hour. And what I do instead is I just said, here's my email address, email me, we'll set up a time when we're both free, and we can talk about it, and we can work through these, whatever issues you seem to be having with the class, and obviously the material.